In this video, we're going to talk about how to differentiate the various causes of hip pain. We get questions all the time about this. We get people reaching out asking us if we can help them with their hip pain. But the first step for you or for us as a practitioner is to understand where is it coming from exactly so we can actually treat it properly. My name is Dr. Todd Pickman. I'm the clinic director of Gonstead Spine and Wellness here in Meridian, Idaho. Let's dive into it. Next concept when you're understanding hip pain is understanding there's a relationship in our joints throughout the entire body, all the way down from the foot and ankle, and really all the way up to your cervical spine. And how that works is every other joint has a different function. So on the very bottom, your ankle should be mobile. So the ankle should have really good mobility. And a lot of times when people have dysfunction in joints throughout the body, one of the joints that gets rigid and starts to get stuck is the ankle. So the ankle should be mobile in a good functioning human. And then you go up to the next joint, which is the knee. And the knee, you should be able to bend it and move it, but it should be stable. That's more of a joint that needs good stability, good activation of the muscles around the knee joint, good connection between your brain and awareness of position and balance. So you should have stability in the knee. Then as you move up from the knee, it flip-flops back and forth. So it goes mobile, stable, mobile, stable. So you have ankle mobile, knee stable. Then you have hip should be mobile. Now, this is a dysfunction we see across the board with a lot of people, and this can lead into hip pain, is that a lot of patients, a lot of people we see out in the community and in our clinic, they have immobility in the hips. Sometimes it's rigidity in the joints for some of the reason we talked about earlier. And sometimes it's just all the musculature around the hip is just very, very stiff because these people do not put their body in that range of motion on a daily basis. And it kind of goes back to that whole saying, if you don't use it, you lose it. So they lose proper range of motion of the hip because they don't explore those movements on a daily basis. So part of the fix here is learning good hip mobility exercises and then doing them on a regular basis to maintain good body hygiene. All right, then as we go up, the lumbar spine should be stable. Doesn't mean it should be stuck and fixated and not be able to move, but it means that it should have good stability. The core should stabilize it. Thoracic spine and the middle back should be nice and mobile, and then the cervical spine stable. We can talk about those things in another video. Foot pronation is another thing that can cause a problem with the hip. So it can actually start at the feet. So the foot should have a nice arch in the foot. When you lose the arch, the foot pronates or flattens in. Flat feet is another word for foot pronation. And as the foot comes in, it causes the lower leg bone, the tibia, to actually twist outwards. And then the femur up top goes inward, and that's internal rotation of the femur. And so as the femur internally rotates, as it twists in, now those muscles in the back that we talked about earlier, which are external rotators, they get put on stretch. And when they get put on stretch, they could also get irritated, and that could be another one of the causes of hip pain. It could be caused from a problem with foot pronation. It could start with the foot. So we look at the foot, we look at correcting the posture of the foot. That is something that cannot be neglected when you are assessing hip pain and wanting to get to the root cause of the problem. And so like I was saying, it causes the femoral internal rotation. The femur rotates in. Okay, so there you have it. That is a breakdown of the different causes of hip pain. We covered almost everything out there. There's probably a couple others that I didn't cover, but if you have any sort of hip pain, or you know anyone that has hip pain, or if anything that you watched in these slides intrigues you as far as just wanting to get a full comprehensive spine workup, you can reach out to us. Our clinic's Gonstead Spine and Wellness. Our contact information will be below. And when it comes to the health of you and your family, results matter most. Thank you for watching. Make sure you subscribe, like, and comment. We appreciate you watching, and we'll see you on the next video. Video presentation by Meridian Gonstead Spine and Wellness of Meridian, Idaho. Our practice is dedicated to people suffering from neck pain, low back pain, tension headaches, migraine headaches, herniated discs, and leg pain such as sciatic. We have treatment protocols for musculoskeletal aches and pains, joint pain and dysfunction, and whiplash injury. Gonstead Spine Wellness offers a distinctive chiropractic experience. It is the only office in Idaho with digital motion X-ray technology, And this advanced imaging tool, combined with the Gonstead spinal analysis and necessary radiographs, enables precise identification of spinal issues. We provide safe and effective Gonstead adjustments, corrective care through chiropractic biophysics to enhance and sustain proper posture, and a 12-week transformation program. This program includes access to a comprehensive video exercise library for ongoing home support, ensuring long-term health and wellness. Call us at 208-888-6077, where results matter most.